there's no diagnostic tool you can use to check a man who has human papillomavirus. But in some cases, you can run a physical examination, which is just checking from head to toe, and maybe on the penis or the genital area, you find what you can suspect it. You can now further proceed to do a tissue biopsy that's taking tissues of the particular organ you saw this wat on. You can take it to the lab and they can check maybe if the human papilloma virus is. But in cases where this man does not have any symptoms, appear with no wat, but still has this virus within, there's nothing you can do.
Like if they actually have. Okay. So moving on, can you tell us the signs and symptoms of cervical cancer?
So the signs and symptoms associated with cervical cancer. Funny enough, during the early stage of this cancer, where the HPV is just progressing, there are no signs, there are no symptoms. This woman feels perfectly healthy. If you tell this person at this point that you might be having this cervical cancer, they will doubt, argue, and say all sorts of things. But as the cancer progresses, let's say it's towards stage 3 to stage 4, they begin to see signs like abnormal vaginal discharge. They can see signs like foul, smelly vaginal discharge, like discharge coming out from the private part, it's stinky. They can have painful, very painful menstruation, or they might be irregular menstruation. If this person is a sexually active individual, they will be having painful sex. During intercourse, they'll be feeling severe pain. And it is usually advised that if you see any abnormal type of discharge coming out from your vagina, like maybe abnormal bleeding or whatever, it is usually advised that you should report to the hospital immediately. Don't assume, don't assume that it is anything. It
Don't
might,
assume
yes,
it is infection. Yes.
it might be everything. You might just say it's a mere infection. You can never tell what exactly is going on in your body. So once you see any abnormal changes in your body, especially in your private parts, your genital areas, you make sure you consult a physician so that you can do a very thorough screening and check to make sure that you don't have cervical cancer. Thank
Okay.
you.
So can you tell us the preventive measures and what we need to do to prevent this cervical cancer?
So thank you very much for this question. Now, the preventive measures of cervical cancer is the main reason why we are here. Because when a person gets this cervical cancer, it's especially you know that there's no symptom at early stage. So there's every chance that it just progress, it gets to the final stage which will cause death. So the preventive measures is very, very important and it's very advisable you share this video to your loved ones and every other person so they can know about this. Now, firstly, it's HPV vaccination. HPV vaccination is the human papilloma vaccination. It is open to all women, young and adults. So this vaccination is taken in intervals. You take doses. You can take it the first dose. When you take it the first time, you can go after a month and take the second dose, then go after 3 months and take the third dose. While some facilities will tell you that they give just 2 doses, and while some facilities you just get 1 dose. So the best thing to do is go to the nearest health center around your community and ask about this HPV vaccine and collect the dose for the betterment of everyone and to reduce healthcare burnout. Thank you. Secondly, regular screenings. Make sure you always go, as a woman, it's better to go for regular screening. Prevention is better than cure, as they say. So if you think financial issues or you don't have money to just go and be doing useless tests up and down, the money you spend for treatment of a disease is way more than the money you are going to use to just test yourself to check if you are okay or not. So once you are tested and there's any sign of, let's say, abnormal changes in the cell, radiotherapy can be done to kill those cells and can continue the management with treatment. Thirdly, you avoid having multiple sexual partners. Just maintain abstinence, stay on your own till you get married. And when you're about to get married, make sure you and your husband do all the type of tests like you ought to do all the HIV, everything. You do it so that you will be sure of who you are getting married to. Thank you.
So go to the nearest primary health care center and get vaccinated. And don't assume that any discharge is infection.
Okay, so there's one important aspect of cervical cancer I would like to address, which is the myths. There are so many myths surrounded with cervical cancer. Like
What is it?
myths are these beliefs, or should I say, superstitions that people say that, oh, if you have this, this will happen. And they are not based on scientific research, they are not based on facts, they were not tested, they were not trusted. This is just traditional people or our forefathers and just saying something, and it's passed down to generations.
All right. Yeah.
Now, one very important, there are so many, like over 20, but I'm just going to talk about one very important one. And it goes this way, it says only promiscuous women can come down with cervical cancer. And I want to clear that particular myth. It's a very big lie and a harmful lie at that. So any woman, and I mean any woman, can come down with cervical cancer. As we said, you can have just one partner you are faithful to, and that partner can have multiple sexual partners, meaning that if he comes back home and to have sex with you, there's every chance of you getting the cervical cancer or having this human papilloma virus, right? So not just promiscuous women. This saying can make women be stigmatized and not want to go to the hospital for screening. They'll be scared that, okay, so if I go and they finally see this particular virus in me, does it mean I'm promiscuous? People think that I'm doing extra marital affairs or every other thing. So please, let's clear this particular myth out of our memories. Not just promiscuous women come down with cervical cancer. Any woman can come down with cervical cancer. Thank you very much.
Okay. Do you have any closing remark for the audience?
Okay, yes. So my advice to all women, like I mean all women out there, is to please take their health very seriously. Please take your health very seriously, all women. Go for regular screenings, go for your vaccination. Any screening that is recommended by the doctor, please make sure you go for their vaccination, and make sure that anytime they notice any unusual symptoms in their body, they should report to the nearest facility. Don't forget that health is wealth, and cervical cancer is preventable and treatable when detected early. Thank you very much.
Thank you, Miss Sophia, for the wonderful presentation.
You're welcome.
And this is a small token from us to you for honoring our invitation.
Thank you very
Well,
thank you very much, Miss Anima Shaun, for this
you're
very
welcome.
wonderful gift. Daily nursing reminders. I really appreciate this.
You're
It's
welcome.
very, 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 very cute, and
Thank
yes.
you.
Just know that you chose nursing for a reason, and your notes today save lives tomorrow.
Aww, clapping. And it's a wrap for today's episode of Behind the Scrub. Thank you for listening, learning, and laughing with us. And don't forget, behind every pair of scrub is a story worth telling. See you next time. Bye. Aww.